All right. Well, let's start kind of top level. What I know is on everybody's mind, regardless. We've got folks on the line with public companies, private companies, various stages of growth. But I know kind of the top of mind thing, given everything we've been seeing in the market, is the market, right? So we've all seen funding in digital health drop considerably over the last couple of years, almost kind of shaved by 2/3, if my math is right, from about 30 down to 10 last year, 30 in 2021, down to 10 roughly last year. We've seen some interesting things going on in the public market with IPOs, both a decrease in the number of companies looking to go to the public market, as well as companies that have taken that step and failed. We're seeing, increase in interest rates, costs rising. We've seen how that filters into workforces, reductions in workforces. There was a lot of that in 2023, a little bit of a slower trickle this year, but we're still seeing some of that. Obviously we've got the presidential election coming up, which could change things, and also maybe creating some uncertainty now. So there's a lot going on. But on the flip side of that, if you look over the last few years, this industry, there's been a tremendous amount of innovation and advancement in various sectors with different technologies, all kind of impacting the quality and efficiency, efficacy of care and drugs that patients are receiving. So I'll open it up to you guys with, what are kind of your thoughts currently on the market, right? Like, where is it today? How did we get here? Where is it going? General thoughts as we kick off here.
Dave, do you want to start?
Sure. I'll go ahead, and I know you got a lot of insider knowledge from your investor perch. Yeah, I mean, so it's been a little bit of a whirlwind, I think, in the last 2 years, having covered this industry a while and seeing it get ignored for a while, heading into like 2019, 2020, especially 2021, just like a rocket ship in terms of like companies getting invested and unicorn valuations, just like so much going on. And that's trickled into 2022, and then kind of slowly started to go back down to reality. A lot of the companies that got those large funding deals, probably didn't deserve them, probably were overvalued by investors. And I think a lot of investors were just looking at this as a FOMO industry, like, hey, I want to get in on this digital health thing too. So you saw a little bit of that. I think you mentioned the RIFs, last year, a little bit this year too. So it's definitely come back down to life, I think, in the last few years. Still very vibrant, very strong. I think AI, especially if you're an AI company, and I'm sure every company will say they're an AI company, but if you're truly an AI company, you have a better shot at getting a good deal in the private market. And publicly, again, very similar trajectory. A lot of companies went public 2020, 2021. I think Halle has some data on that, or someone does. But, a lot of those companies are not with us publicly anymore because, again, they were probably overvalued and either delisted or in the case of some, sold for parts. So, again, back down to reality. With the Waystar IPO last week, maybe a little bit more hope happening now. I'll
and Tempest is this week.
And Tempest too, yeah. So starting to get a little bit, more hope into the picture again, I think, in this year, but still a little far ways off where we were 3 or 4 years ago.
Yeah. I agree with Gabe. I think we were, everybody on the call knows this. We were overly optimistic in 2021 in the private markets and the public markets for digital health. And so what we're seeing now, the companies that either went public, most of them through SPAC, which was very different from going public previously, or in the private markets that had huge valuation multiples from revenue, they have not been able to grow into the 2021 optimism that we had hoped. And so as an investor, I'm seeing a lot of even the most promising companies who are doing really well are doing down rounds, and I'm getting squeezed left and right from later stage investors because these companies, they have, some of them have healthy businesses and they continue to grow, but the multiple was very, very different in 2021 than today. And then other companies that weren't able to grow into these valuations, especially those on the public markets that have public investors who are just scrutinize the company performance a lot more than private investors. We're seeing just a ton of them fold. Right? We saw Pear Therapeutics, Up Health, Q Health, Better Therapeutics, Babylon, like all these companies that were darlings in 2021. If you actually looked at their numbers with today's glasses on in 2021, you probably could have predicted this. But again, we were overly optimistic, and we felt like the growth that we saw between 2019 and 2021 would continue. But actually, that growth had a catalyst, which was COVID. And we cannot continue to grow. We're not getting bigger and bigger pandemics every year that can continue to justify that sort of growth. And so, yeah, I mean, it's a bloodbath. It's awful. It's really, really awful for a lot of these companies that were feeling really good a few years ago about where they were at and just have not been able to sustain that sort of growth, have had, either gone out of business because they spent too much, or what I call is a lot of them are in like hibernation mode. They're like, we just got to get through this. We got to fix our fundamentals. We got to get our unit economics in shape, continue to grow, and maybe take a hairline cut of the valuation, and that's okay. But they're, just want to get through kind of this trough that we're in right now. And on the other side, I think early companies that are getting started right now aren't having problems. And so if you look at Q1 data from this year, it was, I think I wrote it down just so I had it right. So, our Q1 2024 was the lowest quarter that we've seen in 5 years. The number of deals though, so that's just in terms of dollars. The number of deals were actually on par year over year. And so even though it was down in terms of dollar size, what that really indicates is that there were fewer smaller deals, or sorry, not fewer, same size, same number of deals, just smaller deals, which indicates that some of the earlier companies are getting funded and we're not having as many larger, big deals. And I think the average deal size was like 20 million compared to being, what it was in the pandemic, 40 million or something. So early stage companies that don't have the burden of the mistakes that were made during the pandemic, I think are going to be okay. And it could potentially be okay. I think we're in a place where we're really expecting a lot in terms of performance. But any company that had to get hyped up, overly optimistic, now is feeling the burn for sure.
So a couple things in there. You mentioned Waystar, Gabe, and again, like if you look at digital health stocks since like 2018 to 2023, you had NASDAQ up, you had the S&P 500 up, yet digital health stocks were down 28%, right? So you mentioned, Halle, too, some of the companies that we saw shutter their doors that were public, and so we're seeing that, we're feeling that. Gabe, I did see an article in Modern Healthcare earlier this week, not written by you, but someone on your staff, around the Waystar IPO, and there was a sense of optimism. So talk a little bit about that in terms of companies that, because I'm sure there's plenty on the line that are maybe later stage looking at, okay, do we go IPO? When do we think about it? What are some things we need to think about? How you've got a sense of optimism, I feel, coming out of Modern Healthcare. So talk a little bit about that if you can.
Well, to clarify, I mean, optimism, but very much realism. And I think this industry operates on optimism. If you talk to like most VCs, they're going to be optimistic. Like that's kind of, otherwise, like, what's the point? Like, you have to believe that what you're going to invest in will turn into something real and something that will impact people's lives. So, of course, there's going to be optimism. In terms of the article that you mentioned, written by the very capable Brock Turner, yeah, I mean, we're looking at like other companies. There's a lot of companies that like probably wanted to IPO in 2022, but we're like, maybe we should hold off and let this play out. In fact, I know there were a few that kind of like had their eyes on it and then held off, waiting for the IPO window to open. Like, I think there was an article in the Wall Street Journal this week, like how the IPO window is either closed or open, and there's maybe a sense that it could be opening up again. Waystar has done, well for a company in this industry, and that maybe
I
has.
can't get over the name.
I know. They really.
I almost always say
I'm
Wayfair
sure.
every time. That's because I
I'm
get a
sure
lot
they
of
weren't
emails
thinking
from
of
Wayfair.
Succession, but yeah, it does really. I mean, if you've
I
watched this show,
can't
yeah,
believe their chief marketing officer hasn't convinced
yeah, I've
them.
been like, it's named after a very famous TV show. But yeah, so some of those companies that we mentioned in the article, Rowe, Noom, Hinge, Omada, like a lot of these companies are, in a good position to like potentially IPO. They've had a good amount of funding. They've built up their customer bases over the years. It would be like a natural step for a lot of these companies to go public and explore that avenue. And I'm sure a lot of them are. That being said, I don't think that's going to happen like in a wave. Like, as I said to Brock, like Waystar, Tempest, that might be it for the year. I mean, we may not get another one, or at least, for now, like it might be at the end of the year. So I just think they're still going to hold off a little bit, but I wouldn't be surprised if 2025, um, we get a lot more. To your point, like all these companies that went away from the public market, it is there's just begging to be more on there because it is just now like there's just so few companies. We cover all the companies that are public. We listen to their earnings, and like we had a list of them when I started, and the list has just shrunk and shrunk. So hopefully there'll be a few more of those added to the list in the coming year.
Yeah, hopefully. I mean, again, we saw 3 digital health companies delisted in Q1 of this year, so we'll see. Kind of that sentiment there. Hal, I want to go back to you because you brought up the VC, and I know we have a lot of companies on the line that are in that stage where they're looking at either B, C, D rounds of funding, and they're maybe they were funded as part of that big boom in 2021 or post that, but what should some of those companies be thinking about, right? Like, what are VCs looking for? What's some of their top criteria today? And how should those brands be thinking about, sustaining what revenue they or what funding they have now and looking ahead to future rounds?
Yeah. So Lynn Shu of Defined Ventures, I think, said it really well on my podcast when she said it's a tale of two cities. There, at one point, investors just cared about top line at the expense of unsustainable businesses. And then right after kind of in 2022, 2023, they started obsessing around unit economics, but, cared less about scale, and now kind of expecting both. Which is really hard, right? Because you need capital to grow. And sometimes you have to grow unsustainably in order to kind of hit an inflection point and, become more sustainable. But it's really hard for a lot of founders right now. And most of the founders I know are doing down rounds. It's just, that is the reality of it. And I think, it's a hard pill to swallow because the early employees, the founders, early investors are the ones that, are most harmed by that in terms of their ownership. But, I've talked about this a lot when I say, a down round is better than introducing what they call like dirty terms. And so taking a term sheet that is overly complex is way worse. It's just straightforward and simple. If you just have a lower valuation than you did last round, And it's really more fair all around to everyone. And it's a reality of going through a cycle. Companies, deal with this all the time in market cycles. Unfortunately, we're dealing with more than just a market cycle because other industries aren't facing this as much, as not as sustained in other industries, but we're also facing just the impact of the companies that have failed before us, right? There's a blast radius when these things happen. And I think it's both negative because then the tourist investors leave. They, people are more worried about investing in digital health. But then I think what happens is you increase the quality overall. And so now when we look at the companies, the digital health companies, for instance, that are still publicly traded and doing well, like overall that looks good for digital health. Our digital health basket on the public markets is stronger. And so I think we have to go through this cycle of like weeding out the weaker companies, but then the stronger companies are left, and then that's better for everyone. It's hard. The process is hard, but the end, I think, is better for everyone.
Are there things that companies should be focused on more than not as they look at getting their next round of funding?
Sustainability.
I mean, revenue is obviously probably one, right? Like that's a big metric. Like, how are you doing? Probably later on, right? Earlier rounds, it's more about the idea and getting going, and is there a need, and how are you addressing that? And then as you get later on, it's more like, okay, show me the money type thing. Although I think underneath there's always that show me the money sentiment, right?
And retention. I think it's not just selling it once, but keeping customers around.
This is a hard industry to sell into, right? I mean, like health systems, insurers, it's not always the easiest people to sell to. I mean, they just have long sales cycles. I think that's one thing that a lot of entrepreneurs don't realize when they come into this industry, that like it might take you 6 months, it might take you 12 months to close the deal. And a lot of things I hear from investors is like, especially when you're really at the beginning, like you really got to focus on getting those first few customers, before you're getting like even a seed series.
Let me move kind of a layer down and kind of look at underneath the broader market, which we just covered, like specific sectors, right? Within digital health, there's, in your opinion, some performing better than others, some maybe receiving more funding than others. Like what makes certain sectors attractive? What are some of those sectors? Maybe what are, on the flip side of that, like what are some sectors that maybe were VC darlings and now have kind of been pushed to the outskirts a little bit more? And
I would say if you read what Gabe is writing and the companies that he's favorably covering because they're doing well, those tend to, those sectors tend to drum up more interest. And then on the flip side, like digital therapeutics, like that would be a tough sell right now. It's trend-based. It's very much so. I feel like just read what Gabe is writing.
Oh, and then, thank you.
The investor
he is the voice, right? So yes.
No, I mean she's right. There's just certain things like it's just like momentum is this like feeling that it's like you just like if you are an AI company, you feel good about yourselves right now. And I think we said before the call started, like everyone will say they're an AI company, but like investors are going to like scrutinize that to death to understand like how much of an AI company you are. But if you are one that they believe in, like a company like Hippocratic AI has gotten all this funding, based on like almost a concept, and just kind of shows you that there's still money and checks to be written out there.
That's one fund though.
That's true.
That doesn't play by the rules.
Definitely the exception, but that is one area, like just in general, that I do think there's. And there was a report this week on AI healthcare investing that showed how promising it is. And obviously, like GLP-1s are the other one that people
oh my gosh,
not stop talking about because they're like this
weight
magic,
loss. Weight loss, menopause. In terms of like areas within healthcare, I would say definitely weight loss. As I said, menopause I feel like is having a moment. Cancer care, I'm seeing a lot of companies around that. Medicare, I think things in the Medicare space are also really interesting. I would say mental health feels a little bit more saturated.
Yeah.
I'm not seeing as much like investor appetite in mental health.
There were so many companies that came out in mental
Yeah.
health.
Yeah, diabetes feels like, it's so, it's like that was really, really popular 5 years ago. And then, it becomes more saturated. You start to see winners. And then, the investor's like, well, there's already Omada Health out there. I don't need to invest in another one like this. So.
Well, let me ask that because, so we do our pan health pulse and we kind of look at conversations trending and driving the market. And you guys hit on a couple there, like behavioral health, mental health, right? AI, obviously, value-based care, interoperability. These are big ones. Digital therapeutics was getting some pretty good attention, but to your point, Gabe, might be a tougher sell now from the investment standpoint. But building off what you guys were just saying around there's some of the kind of the gorillas in the market, and then there's these other ones around AI and other areas that are trying to break in. So Gabe, from putting my media storytelling hat on for a lot of the communicators and marketers and PR folks on the line, from your standpoint as the editor at Modern Healthcare around digital health, what do those companies need to be doing in terms of telling a better story, right? To kind of break through the clutter and the noise and really stand out. Put like the investment stuff aside for a moment. Just think from a brand standpoint.
It's hard. I mean, I won't lie. It's very hard. I saw Halle has an automatic reply for her email, and I was almost thinking I should get that.
She wrote a nice blog post on that too, if you want to check out. Yeah.
I mean, honestly, there's just so many companies out there trying to get play, and especially if you say AI and GLP-1s and like these hot topics, like it is hard. It can't just be like you're doing it and like you have a customer. Even that, like I used to like come to these things and be like, well, if you have a good customer, we'll talk to you. Now that's just like, unfortunately, like I can't be like, well, and this is one I just saw, so I'm not picking on them, but like Tampa General is doing this with AI, and I think they're using Nuance, not Nuance, it's in their health system, Nuance. And it's like, okay, they and many others are doing that. So I feel like there's got to be like some other angle. So I would like hammer at like whatever is unique about your company that you're working with. That if you think it's too finite, like do it anyway, because there's so many companies, there's so many medical transcription companies doing AI now that like, okay, how are you different than all these other companies that are doing it that are probably more well funded? So it's just it's hard. I think as detailed and as possible, and it doesn't hurt to like know me. And this is not like an ego thing. It's just like if I formed a relationship with you, I'm going to be more willing to listen and talk about it and hear you out. If you're just like sending me an email that you've sent to like every other reporter, every other editor in our industry, then like that's going to make me less likely to comment. I know you have to do that at times. I'm not saying you should never do that, but like also make an effort because it's easier to explain things, I think, on the phone. So yeah.
I have a few things I think I would focus on as a founder or someone in a comms or marketing role right now. I think evidence is one, and really figuring out a way to stand above the rest. And we're starting to see like the Peterson Healthcare Technology Institute. If you're not going to do evidence and figure out the efficacy of your product, someone else is going to. And I would start like measuring things now and looking at real world data and partnering with researchers. So that's one thing, like just gather as much evidence, because it also should be informing your product. Like, look, like we're spending time, like the stuff that we work on might as well work and improve healthcare. So it's good to know, even if it's something that you don't share, if you're not proud of the results, then it should inform your product roadmap. If you are proud of the results, I think it is something you could take to Gabe. And the second thing I would say is like figuring out a way to plug into the zeitgeist. And not every company can do this, but if there is, like, so I'm on the board of Co-Fertility, we do egg freezing, and like there are moments when like egg freezing is something that is on, you know, people's minds because of regulatory things or just like celebrities who mention it. And so we're always trying to like plug the company into those moments of the zeitgeist. And I think that many companies can kind of figure out ways that their company is relevant at certain times. And then the third is I'm always preaching this to the companies that I work with, but as a healthcare company, you really have to take a stand. You have to decide like what you stand for and continue to take a stand on that issue. And there are couple companies that I think do really well on this. Bobby is one. This is something especially for direct to consumer companies, but I think every company can really take a stand. But if you're a company in the mental health space, then, you know, making sure that you are standing up for regulations that are favorable to folks and calling out biases and just standing up for your end users. If you're a company that touches LGBTQ lives, like June is your moment. And so I think, you know, I don't think companies should speak on every single political topic, but I think that you have to kind of create, like, what is your stance? What do you stand for as a company? What sort of rights, human rights, are you standing for? How does that tie to your core promise and purpose every day? And just continue to be very vocal about that. And then Gabe will come to you because he'll be like, oh, this is interesting. Like, they're the ones that are
No, for sure.
always talking about this issue. I want to cover this issue. I'm going to go to that company.
It's so true. And I would say like one of my biggest pet peeves, and it's, you know, it is what it is. I think it's hard. A lot of this stuff is complex, but like if you don't know the company, what the company you're representing does, then you got to figure that out, because there's a lot of times where I talk to these people, it's like a basic question, like, give me the elevator pitch, what it is that you do. And I understand some of it is technical and it will be hard to explain, but you got to try your best, because
Yeah.
it's
And it's
just
like, but what is it like? What if it's a complicated like AI tool for like hospital administrators? But at the end of the day, what you do, what you stand for, is freeing up clinicians to do what they're really good at,
bingo. Right.
reducing clinician
Yeah.
burnout. Like, that
Yeah.
is taking a
Yeah.
stand. Like, you believe
Yeah.
that clinicians are the most important element of our healthcare system, and we need to protect them at all costs. And it's very clear that they're burnt out, and this product helps
Yeah.
resolve that. Like, that's what
Exactly.
you do. You're not
Yeah,
some
you
like,
gotta
you
think
don't
of
explain the
it like
technical piece of
Shark
it.
Tank or something, or I mean, really, that is like what investors are going to want to know. Like, is
What
like
do you
that
stand for?
basic.
What's
Like,
your mission? Why are
yeah,
you
what's your
doing
mission?
this?
Who are you trying
Yeah.
to get
Yeah.
at? What's the problem that you're trying to solve? And especially if you're a young company, like you got to like make sure everyone you hire and bring on, whether they're in-house or you hire an agency or whatever, they should know that, and be able to speak to people like me and Halle. So like we don't have to like look it up and be like, they're doing what now? Like, how do I, I'm not even sure where this would fit in with our coverage. So
Yeah.
I'm pleading for people to do that more.
Cool. Yeah. A quick shout out. We work with a company, Duos, and I know Jen is on the line. Jen Kerfoot, amazing. And like you talk about a company that's like really very driven by their mission, what they stand for, and what they're trying to do. Her company Duos is amazing. So I think they're an awesome example of that. So shout out to Jen there, because she's doing an amazing job there. Before we leave kind of market sectors, I want to flip it a little bit and just quick question, like, are there areas we talked about, GLP-1s and mental behavioral health and AI, of course, those are getting a lot of attention. There's a lot of activity, both from brands telling their story, VC activity, et cetera. Are there areas that you all are looking at that maybe aren't getting as much attention, that are the sleepers, or there's opportunity there that maybe hasn't been either clearly articulated, or they're still younger, earlier stage companies that maybe haven't evolved into something bigger where they're ready to tell their story or make a big splash, like anything that way that's not getting a ton of attention? that you might be keeping an eye on or you're hearing?
I'll pass this to Halle because it's hard to think of one. I just
Go
feel
ahead.
like
I can see Halle was thinking too.
it's hard to think. Like
Punted it to
everything
her real
feels
quick.
like it's properly hyped at this moment.
Yeah, exactly.
Or
Everything does
overhyped.
feel-
I mean, there are areas like that should be funded and covered more, even by folks like myself. Like women's health is perpetually underfunded and undercovered, and like I think we've seen momentum, but like it's still way, way behind what it should be when you break down the statistics. And you could even like break down. I mean, women's health is so broad. You go to, maternal health. You could go to menopause, which is an area that's getting increasing focus. But it's a hard one because it's just everything feels like it's been
Exactly.
properly hyped up. Properly
As we
covered.
said, as Gabe and I have said, like we were overly optimistic
Right.
and we overly hyped things a few years ago, and we're like,
Yeah,
now we're dealing with the hangover. So
yeah,
we drank too much.
we drank.
That's
Yeah,
all I
even
can
like
say.
areas like Medicaid, like with social determinants of health. I mean, there's companies that have gotten a lot of funding in that area, and some of them have done well, and some of them haven't. And so it's like areas that you think might be needing more coverage, like did get a lot of hype and funding. So yeah, I think it's more interesting to see like the next wave, what are the areas that are going to get, other than the ones that we've already talked about, the obvious ones.
Okay. Maybe we'll revisit that. I'll ask you all
Yeah.
to kind of look into
And
your
that's
crystal
it,
balls
yeah.
at the end of the conversation and start to think about 2025 and what some of those areas might be. But I want to go back to, you mentioned some legislation as we were talking about brands and kind of standing up and standing by and representing themselves with what do you do and why is it meaningful and what are those moments in time, or how do you take a stand if there's certain legislation and different things going on, Halle? And I think one of the big elephants in the room right now in terms of some of the market uncertainty we've talked about and what companies are doing right now, there are some things hanging in the balance as we look ahead at the presidential election, right, coming in November. And I think the first debate between Trump and Biden is going to be June 27th, something like that, later this month, anyways. And I don't think we've started to see a lot of definitive statements from either side in terms of what it could mean or what their plans are for healthcare. Obviously, we have some history to look back on when Trump was in office and now when Biden's been in office. But just as we look ahead to the presidential election, are there things that we should and companies, brands should be focused on from the legislation standpoint? Again, trying to be apolitical here, bipartisan, not looking for hard stances either way. But, when we think about the election, what could be most impacted by the outcome of that? What sectors, legislation, pending policy, stuff like that in your minds?
Gabe, you start. You're closer
Yeah, I'll
to
start.
the
I mean,
She
like
returned the
we're
favor,
talking
Gabe. She
about
punted
this.
that right to you.
Yeah, we're talking about that. Well, it's deserved. I just did that third. And but we were talking about this before the call started. It not a lot, because I think in general a lot of the stuff is bipartisan, and I think certainly in the digital health and telehealth sphere, I would say a lot of that is bipartisan. And even if Congress like can't get its act together enough to pass laws, like I think most of them agree, like the rules around telehealth flexibility and remote prescribing or something that like they should at least extend while they continue to do more research on it. There are areas where they're diverging. Obviously, like the ACA is something that Trump and the Republicans in the past have talked about repealing. I'd be very surprised if that happens. It's a pretty popular law, and like it's kind of political suicide to do it, to the point where like if he even mentions it in his talks, like Democrats are fundraising against that like almost immediately. So I do think like that would be unlikely. There are areas though, like of like that if Republicans won, that they tend to be a little bit more, restrictive on, you know, certain areas of like, obviously like abortion care and certain areas of women's health and access. So I do think there are like these ancillary areas and digital health that could get affected um, by the election. In general, though, I tend to think that it won't matter as much as certain other things, whether it's like SCOTUS or just market dynamics.
Yeah. I agree with all of that. I think, regulatory risk is something that is the only constant. And so just making sure that you have someone on your team that is understanding that, so you're able to navigate the uncertainty there, or, having the right lawyer, consultant, whatever, whoever it is, so that you're never caught off guard. There will always be regulatory risk in healthcare.
And I want to note someone in the questions mentions this SCOTUS case on agencies. I think that's getting like underplayed in coverage because like healthcare is an area where like agency shape a lot of policy, whether it's CMS and HHS. Like there's a lot that does happen at the agency level in this industry. So I'll be curious to see what happens with that. That's the Chevron deference that's, I think, going to be decided like soon. So that'll be one to watch. I think the question's asking if, what impact it might have on investments in companies. That I don't know if I can answer. Is more like that's a harder question to answer. I don't even know how many of these companies know of this, decision, but I do think it actually will play a somewhat big role in healthcare because of the role that CMS and HHS play in shaping healthcare policy. So I wanted to give a shout out to that question because it's an important case that will be decided very soon.
Okay. Halle, anything to add there
Questions?
before we move?
Yeah, I think we have some good questions in here.
We do, yeah.
Sergey always with the tough ones.
Yeah, there's some great. Is there anything else? I'll just open it up. Anything else you guys want to add to the conversation that things we've talked on thus far?
No, I mean, I'm glad that, someone asked about cybersecurity. That's a good, it's a very pertinent topic that, like, even with everything that's happened this year, still probably doesn't get enough, coverage or doesn't get enough, like, attention because it's not sexy. But, like, clearly there's a major issue happening here. It's just like a widespread problem. I got a phishing attempt yesterday from my dog's veterinarian. I was like, what? This is weird.
Oh
Why am
my
I getting
God.
a request for payment for my vet? That's weird. I didn't go there today. And then I realized what it was. I was like, oh, wow, that's clever. So I'm glad someone's asking about that because I do think that is just, obviously massively important right now. Clearly, there's a major issue in this industry.
Yeah.
Yeah, I mean, and it's funny because I think there was like some moral boundaries, right, with hackers and malware and all these other things that
Yeah, that's gone.
healthcare was kind of hands off. But now I think we're starting to see that barrier broken down, right? And I think your point, Gabe, it's been something that it's been happening, but really the change healthcare.
Well, last year was the worst year in terms of like the number of patients who had their data breached, according to the OCR data. But this year is certainly going to make a run for it with change and ascension.
Yeah.
But yeah, to your point, like the morals that used to maybe exist, and I don't know the hacker world that well, but if there were morals on like, hey, we shouldn't hack a hospital or a children's hospital, like it seems like that's
I
long
thought I
gone.
saw you running around earlier, Gabe, with your black hat on. Maybe not. That might have been.
Yeah, I think they've realized like how exposed this industry is in terms of data security, and they're just realizing it's a gold mine. So the problem, unfortunately, I think will get worse before it gets better.
And
I don't know
the
if
question in the
investments
chat,
though. Holly, is that something that you're seeing? Like, are companies like are investors looking at cybersecurity companies?
Yeah, absolutely. Absolutely. There's
that
been
was a
more.
question in the chat. Is
Yeah,
the brand's
there's,
going to focus more on that, and VC is going to focus more on
yeah.
that?
Yeah, too much reputation risk, legal risk, and I think having some high profile cases has, and not just Change Healthcare. I mean, the 23andMe breach, and they're like scaring founders. All the founders on the call right now are probably, have thought through it and are investing in that area.
There was a question here too I wanted to get to. Oh, around telehealth, virtual care. Obviously that was one of those sectors, Halle, that you mentioned, kind of got a real big lift around COVID, right?
Yeah.
The question here is, it's been a rough first half of the year for these telehealth and virtual care companies. Kind of where do they go from here in order to course correct?
Yeah.
And I think it's, maybe we start with the companies themselves in terms of how they're structured, what they're trying to solve, and internal operations. Like, what are some thoughts there? If either of you guys have that.
It hasn't been a terrible first half for all telehealth companies. Hims is doing quite well. I know Row is also doing well. MIDI Health, which is virtual care for menopause, is doing so. I don't think that every telehealth story is a downer for the first half of the year. I think there are particular companies that have struggled, obviously, and I don't know. I mean, maybe it's more of a, Gabe, I'm curious what you think. More of a company micro problem versus a macro problem, because there are companies that
Yeah,
are
there's
thriving in
some that are
telehealth right
doing
now.
well. I mean, there are companies that are succeeding. You mentioned Hims. Um, and I do think like even the companies that have been like hyper scrutinized, like Teladoc and the ones that are kind of out in the public a little bit more, like a lot of them I do think are probably, if they can get through, a little bit of this rough patch, well, to your point earlier, we'll be in a pretty good spot going forward if they can figure out kind of the areas that they need to focus on. Like mental health is such a big one. And like if you look at Teladoc, they have a lot of people using their BetterHelp. So that's like an area where, you know, you can build off that. And I think
Yeah.
now that like we've kind of like had a few years to like look through like what telehealth adoption looks like you should be able to like focus on like the areas where it makes sense. Rural health, like that's an area that needs more providers and needs better access to care. I just talked to a rural health provider that's using telehealth to expand for specialty care.
Yeah.
So like there's definitely like areas of promise. I just think like the be all end all, like the kind of the general primary care stuff, like a lot of that just isn't going to work out, I think.
Yeah. One other thing I would just add to that, I was speaking to the Talkspace CEO, and he brought up a really great point around just telehealth being part of the solution for like clinician burnout, and offering alternative employment models where you're part-time, where you're working from home, and thinking about the flexibility that a telehealth job offers as a benefit to keeping nurse practitioners and clinicians, keeping them working in a way that makes sense for them.
Yeah.
And what about on the patient side too, right? Like, I think there's opportunity when you think about remote populations and those that aren't easily
Yeah.
accessible to facilities, right? Like, I think there's opportunity there. And then maybe also we're seeing a big uptick in kind of telehealth when it comes specifically to mental and behavioral health too, right? Like being able to hop online and speak to someone relatively quickly versus
Yeah.
making an appointment and
There's
all
a
that.
huge shortage of mental health providers. I mean, there's a huge shortage
Yeah.
of all providers, but mental health, especially, like if you are trying to find a therapist right now, it's very hard. And then if you're trying to find one in network, it's even harder. So, like, there's just a huge need out there for a lot of these services. So, like, there was all these articles after like the Walmart thing and Optum, like, oh, it was
Yeah.
telehealth, blah, blah, blah. And maybe we even contributed a little to it. If so, I apologize. But like, I mean, like, clearly
Thanks, Gabe.
not, it's clearly not dead. I think
Well, I
it's
think,
going through like the natural progression, right? Like,
yeah,
it's just not going to work for everything. You can't like examine someone through a video screen. So like, that's not going to work out. Like,
unfortunately, yeah.
yeah.
I think we have to separate like the efficacy, cost savings of certain modalities like telehealth
Mhm.
and the business case around it.
Yeah.
And these things, obviously, you have to have a sound business case in order for these companies to be sustainable and scalable. But there's also opportunities for hospitals to, and I've worked with a hospital CEO that has been doing incredible work to do rural healthcare. So they're the largest hospital in South Carolina, and they're serving rural communities across the state that don't have access to specialists. And so maybe it's not like a standalone business, but like this is moving the needle for that hospital and for the patients that they're able to see. So I do think that there's been some business mishaps in telehealth, but that does not mean that telehealth is not a very um, promising just way forward in healthcare overall. We just got to figure out businesses that work
Yeah,
and
and
maybe,
that's pretty
yeah,
typical of any like developing industry. I mean, like if you look at the internet 25 years ago, it's a lot different place than it is now.
yeah,
I mean, people were like, Amazon, the book company, they're gonna do what now? Like, and clearly like it worked out for them. And not to say there'll be an Amazon, but like companies will come out of this stronger and
yeah.
knowing what they have to do. So
I
plenty of
want to answer
reason.
one of Sergey's questions. I feel like it's a
Is
good
that the
one.
AI one?
Well, no, the first one. We can do the AI one too.
Okay. Yeah, I was
He's
going to
always
try to
asking
wedge two
questions.
questions in around AI into one, but yeah, if you want to take the first one around the
Well, okay, so
valuations.
his question was when we talk about valuation in digital health, we talk about revenues, not profits. And I believe VCs are to blame for this. Their goal is to get an exit at someone else's expense. In my opinion, regular mom and pop investors often suffer the most in the end. Mom and pop investors, never heard that term for angels. I think you're talking about angels here. I love that, thinking about that. And I think that's right? Like investors have a mandate. Most investors, unless you're the Gates Foundation or California Healthcare Foundation that does, impact investing, other investors, they only stay in business if they have huge returns. And at a lot of times that is at odds with the impact that a company is making in healthcare. And we've seen that go sideways many a times. And I think I think it's a really good point. And what I always really advocate for is always like aligning the margin and the mission. And so we think about the incentives that motivate a company. And if that is not completely in line with a company's growth and sustainability, then you run into this gray area. And many healthcare companies, including every single health insurance company except for the payviders like Kaiser, the margin and mission do not align. When I think of dentistry, that's like one that gets me the most, right? Like a dentist makes more money the worse your teeth are. When I think of fertility care, like my fertility clinic made way more money because I was very infertile and needed way more treatment than if I would have gotten pregnant immediately. And unfortunately, most places in healthcare to date have benefited by not actually helping people achieve their health goals. And so
Mhm.
what I think of like the opportunity for innovators now, it's really on like, let's focus on models where we can completely align the margin and the mission and grow and have those things kind of grow together.
It's a great answer. And I'm going to tack on one more there for both of you that kind of ties to AI. More focus on the patient, like AI. We've been hearing a lot of hype for years. And now I think we are starting to get to the point where you're seeing it have tangible impact in certain areas of healthcare, right? But the question here is, do you think patients have?
Um, to a degree, but a small degree. I mean, like, I think it's still pretty much like contained to pockets at like some of the leading, health systems and providers. And often maybe it will be something like basic, like transcription or, being able to talk with a chatbot or something that's like not like low stakes, but like the big stuff, the clinical AI, that's still pretty emerging. And I think the big promise of AI in this industry is still a long way from being recognized. I think someone I talked with about this who knows a lot about it, a lot more about it than I do, is like, we'll be in the hype cycle a while because like there's still just so much potential out there that like we're not even close to realizing it. And you are seeing tangible results, but like a lot of it is on like some of the low hanging fruit that like you would expect, like there's a reason why there are all these transcription companies because that's like such a obvious area of disruption. Doctors are spending
Low
like,
hanging fruit.
yeah, low hanging fruit. Yeah, like they're spending like hours after their day doing like work in the EHR, all this pajama time. Like, of course, that's something that we should be working on. That will have a tangible impact, and that will translate to the
Yeah.
patients because they'll be able to spend more time. But like, yeah, that true kind of like being able to, detect like if a very, like if I specifically am at risk for something and like, that stuff is still emerging, but I think it will
Yeah.
happen sooner than we realize.
Yeah, my sense on it is right, like a couple areas in particular, right? Like you think about clinical trials and AI's impact there, like it's helping the drug manufacturers, the biopharma companies, right? Or you think about AI on the admin side in the provider setting, and it's helping the doctors and physicians in terms of workload and balance and burnout there. And I think maybe the next step is how does it really make a positive step forward to impact patients, right? That's my 2 cents. We've got 2 minutes. So I'm going to end and I'm going to poll the audience too here about, and I'll ask you guys this question, what sectors or trends do you think will have the biggest positive impact on the industry? And maybe think about it through the lens of being able to deliver efficient, effective, holistic, quality care to patients, right? Although you don't have to, but I'm giving you some parameters. Maybe that's it to help streamline.
Are you asking us? You're asking the audience. Okay, you're asking the
I'm
audience.
going to pull the audience, but I was asking you guys kind of simultaneously.
While they answer that, I want to answer the other AI question.
Okay.
Which was, I don't know if the audience can see it, so I'll just like summarize this question and another one from Sergey. Was that AI and digital health right now, in his opinion, is all hype because they actually aren't innovating and they're secretly just using OpenAI's APIs. Which and that they won't survive because they haven't done any innovation in AI, which I think is a really interesting point. But I would argue that there was a really great article in HBR years ago that was like, we need more imitation, not innovation in healthcare. But the point, and I think we need both. But the point was that we have an implementation problem, we have a distribution problem. It takes a really long time for things to go from like bench to bedside, whether that's like a new technology to like, being fully used. And so I think it's okay if we start with like known, trusted technologies that if they can show that they're improving healthcare, I don't care if it's novel or if it's like chat GPTs, if it's like a trusted technology that is reducing costs, improving outcomes, et cetera. I think that's okay. But I agree that what's not okay is like misleading reporters, misleading investors that like you're innovating. Like it's okay if you're using a technology that's already proven and you're applying it in a new way. And that to me is okay. I think misleading others about how innovative you are is what's problematic.
Yeah, I completely agree. I think it's fine to use an AI. They clearly, know what they're doing, and but you should be upfront and honest about it. And like a lot of these guys will say, like, yeah, we're developing our own LLMs, and like you press them on it, and it's kind of like, are you really, like that meme. But to Hallie's point, like if you're using something that's established, who cares if you're getting the results? Because I do think to answer that question, like I do think that is the biggest area of promise right now knowing what it's capable of and knowing
Yeah.
like how much like it could change this industry, it's hard not to get excited. You can be skeptical and you can look at, companies and say like, what are they actually doing? But like anyone who you talk to who knows what they're talking about, like will just say like, this is like the iPhone, this is like the internet, like this is like the next thing, and you got to hop on board. So I do believe that, and I'm excited to see what it can do to an industry that badly needs it.
Okay. Well, the audience, the AI was one of the answers in the poll. The audience, that was second. The audience kind of went with patient engagement, patient experience kind of being a big area that will have the biggest impact in the next 12 months. So I think that's a good place to leave it off, because I think if we start talking about it, we could talk for hours, and
Yeah.
we're
Yeah.
just after 1 o'clock. So I will be respectful of folks' time. Gabe, Halle, thank you guys so much. Amazing
Yeah.
conversation, great insights. Audience, thanks for joining. Hopefully you got some good things out of this, and reach out to any of us if you want to continue the conversation. But thank you all, and definitely check out Halle's stuff and check out Gabe's stuff, and they're going to continue to do great work in the space. So appreciate you guys.
That's right.
Thank you.
Thanks for having us.
Yeah,
Of
thank
It
course.
was great chatting with you guys.
you. Yeah, absolutely.